we'll start with something called as cerebrovascular accident. As the name suggests, cerebrovascular, it means the disease of the vessels which are supplying the cerebral cortex and the brainstem and the cerebellum. So the word cerebro, it means something which is related to brain. Vascular means something which is related to the blood vessels which are supplying the vital organ of the body which controls the entire human body. So what do you mean by cerebrovascular accident? The common name for cerebrovascular accident is a stroke, or it is also known as cerebrovascular accident, which is defined by an abrupt onset of a neurological deficit that is attributable to a focal vascular cause, which means that anywhere there is a damage in the brain, there is some form of the neurological abnormality or deficit. The word deficit means there is a lack of functioning of that particular part which has been damaged and which has been represented functionally on our body. Like example, the area which has been supplied in the brain and that is controlling my right arm, if that is damaged, there will be a neurological deficit of the right arm. So we have to understand the entire correlation, because the objective of this session is first identifying what kind of a neurological deficit it is. Second, to know whether the higher centers have been preserved or it has been damaged, or there is a malfunctioning of the higher center. Third, which area of the brain is been getting affected, and fourth, with what kind of a vessel which is supplying this area has been affected. I mean, whether it is an anterior circulation problem or it is a say posterior circulation problem. So that kind of a vascular territory diagnosis is also important when we are dealing with cerebrovascular accident. So basically these pathologies, they develop because of the ischemia to a part of the brain, or there is a hemorrhage, localized hemorrhage into the brain, which eventually leads to death of the brain cells. So this is very important. Either the vessel which is supplying that vital area is getting blocked, that is known as ischemia, or the vessel is getting ruptured in and the blood is getting extravasated or accumulated in the brain, which is leading to increase in the intracranial pressure or intracranial tension, eventually leading to the cerebral edema, and the normal tissue of the brain is getting compressed